All right, beautiful evening to every one of you watching us right now. This is your favorite station, Esteem Radio Vision, and this is your program, Earth Corner. And what we do on Earth Corner, we talk about things that pertain to our health. You know, like we do say on this program, that make sure you prioritize your health. Health is wealth. And on today's edition, we are going to talk about a particular topic that will interesting our viewers, especially the women. Let me say women in general. It will be of help to every one of you. One thing I will advise you right now is to just make sure you find a quiet place to listen as we will dive into today's topic. And let me use this medium to appreciate the Chief Executive Officer and who is the executive producer of this program, Deacon Michael Adeboye Ashaolo. Is also double with the founder of Enia Moli, and this program, Earth Corner, is being proudly sponsored by Enia Moli Foundation under the tutelage of Deacon Michael Adeboye Ashaolu as the founder of the foundation. Adenipekun Afolabi is my name, your prince on the show. And let me quickly appreciate the man behind the console, and that is Balogun Absamad, for his support. Thank you so much. May God be with you. And like you, for the sake of those who are joining us for the first time, we do have our guest, who is a health practitioner, nurse Nwoko Ezinne Mary Constant. She is the one who will be giving justice to all our questions, and from there we'll be able to get one or two things. I think now I have her on the line with me. Good evening, Nurse Nwoko Ezinne.
Good evening, Mr. Afolabi. Thank you so much.
Okay, let me say happy weekend to you. How is the weekend, ma?
Very well. Thank you.
All right, ma. Today, we want to talk about our heads, and the topic that we want you to enlighten us on as a health practitioner, you are. We want to talk about the postpartum hemorrhage. And for someone like me, what I understand it is like a, let me say, when you have uh, excess blood, or when the blood is gushing out after birth, that is what I understand it to be. But you, as a health practitioner, what exactly is the postpartum hemorrhage and why is it dangerous?
All right. Thank you for your question. Well, for a kind of introduction, I would like to introduce the topic postpartum hemorrhage first. It is one of the leading cause of maternal mortality and morbidity worldwide. It is one of the leading cause. So, and it happens among the low income earners and middle income earners. It is also an obstetric emergency. If you identify it quickly and act quickly, you can prevent death. So the most of the cases can only be prevented through timely intervention and properly functioning health system. So for the definition of postpartum hemorrhage, World Health Organization defines it as the blood loss greater than or equal to 500 ml after vaginal delivery, or blood loss of 1,000 ml or above 1,000 ml after cesarean section, or any amount of blood loss that can result in hemodynamic instability. What I mean by hemodynamic instability is anything that can affect the woman blood level, any volume at all after delivery or cesarean section that will affect the woman's normal body system. It is known as postpartum hemorrhage, especially if it happens after delivery. It is known as postpartum hemorrhage. So anything above 500 mils or equal to 500 mils after vaginal delivery, anything above 1,000 mils or equal to 1,000 mils after cesarean section, or any amount that will result in any discomfort in the woman's life or daily living is also referred to as postpartum hemorrhage. Thank you.
All right. Thank you, Ma. During your course of discussion, you said if it happens after birth, it can be referred to as uh, postpartum hemorrhage. Okay. What I want to ask: can it occur even before the birth? Can someone have a excess blood or bleeding uh, before birth?
Yes, there are some things that can cause bleeding before birth, but it's not known as postpartum hemorrhage. We have placenta abruptio, things something like placenta abruptio, revealed placenta abruptio, which is another topic of its own, can cause bleeding before delivery. Thank you.
Okay. Now, why is it so dangerous? The postpartum hemorrhage we are talking about, why is it uh, so dangerous?
Well, it is so dangerous. Like I said, it's one of the leading cause of death among women. It is dangerous because one, after delivery, the womb itself, let me come down to a layman's womb. Let me not just use the medical terminology. The womb, like it now, is like a wound. So it needs to kind of constrict together and close the blood vessels that are now open where the placenta detached from. But when it does not happen because of no what we call the uterine atony or lacerations or anything at all that can cause the bleeding to continue, you find out that because the blood volume, the areas of the surface area, the blood vessels there are highly vascularized. So if you do not do anything to stop the bleeding, the woman can die in seconds, maximum minutes, because there is a huge loss of blood. So, and if there's no immediate intervention, the woman can suffer from shock, and from shock may even die. So it is a very dangerous condition because a large amount of blood can be lost within minutes. It can lead to shock, it can lead to organ failure, it can even lead to death if nothing is done immediately to kind of harness the condition. Thank you.
All right, okay. How common is postpartum hemorrhage in the, I mean, globally, especially, let's look at it from our own country, right from the Africa to Nigeria. How common is postpartum hemorrhage?
All right. In studies have shown that in Africa and Nigeria, the rate of postpartum hemorrhage is higher because there is limited health resources and there is delay. People that have postpartum hemorrhage, because before they will get to home, where they will get to healthcare, healthcare, there will be delay in seeking for care, and so most of them die on the way, or because there is people that are even deciding to take them to healthcare center will be doing one or two things to delay them. So it will cause death before they will get to their healthcare centers, and also because some of them prefer to deliver at home. Globally, it affects about 5 to 10% of all deliveries. So, but in Africa and Nigeria, the rate is higher than 5 to 10% because of these two reasons I mentioned. One is lack of healthcare center, lack of resources, delay in seeking care, and more people are looking for how to deliver in the home instead of delivering in a health facility. Thank you.
Okay, thank you, Nurse Nwoko, for that beautiful response. Apart from the blood clotting disorder, what other things that can cause this postpartum hemorrhage?
All right. The major causes, there are a lot of things that can cause postpartum hemorrhage, but one of the major causes is what we call the uterine atony. When I mean uterine atony, it means failure of the uterus to contract. It is the most common cause of postpartum hemorrhage. Then another thing that can cause postpartum hemorrhage is what we call retained placenta. When we discussed labor, we talked about retained placenta. If a placenta refuses to come out, it could lead to bleeding. Or maybe when we have another cause could be genital tract tears. As the baby is coming out from the vagina, there could be tears or maybe manipulations, how the baby was manipulated to come out. There could be lacerations in the woman's vagina or cervix or anywhere. It can lead to postpartum hemorrhage. Or uterine rupture because of excess induction or augmentation or even natural contraction. Excess natural contraction can lead to uterine rupture. Then blood clotting disorders, like you said, can also cause postpartum hemorrhage.
Okay. Now, with this, now I want us to look at this. Most of the time, we heard about the story or the news that the health practitioner during the birth delivery, some may forget one or tools in the in the vagina or in the womb of the woman, and can this be a part of causes of the postpartum hemorrhage?
Well, in the course of if a woman, that is why I'm always hammering on going to a skilled personnel, a midwife or a gynecologist. There's no way a sound gynecologist or midwife will leave something inside a woman's vagina. Before, after delivery, you make sure you empty the uterus, make sure you rub up contractions. And sometimes they put some people practice, they put a kind of pad, a blockage, a pad. They will tell you to remove it when you want to go and urinate, or maybe after some time. That is not leaving something inside there. I know what you're trying to talk about. Maybe during surgery, they can leave during cesarean section. They can forget
Yes.
scissors. They can forget swab and all that. It can happen. It's called negligence. It can also happen. It can happen. It happens. But that one is due to negligence, or because maybe the staff are underpaid, they practice whatever they like and all that, but it's not supposed to be. It's not a good thing. If it happens, it can cause a lot of damage. It can cause decay of the wound. It can cause necrosis. It can cause a lot of harm. It can also cause bleeding as well. Yes. So, but that should not happen in a well equipped center where everything that happens is being taken care of. Because if it is in a standard theater, anything you use during surgery is being recorded on a board. So before the surgeon close up the woman, they count everything they use to make sure it's complete. So there is no way they will leave anything inside. So is there a place where that is not well equipped, not well standard? That is the places you can see things in the news of. They leave scissors, they leave swab, they leave cotton wool, they leave gauze. So those things don't happen in a well-established centers. Thank you.
Okay. Now, my question now is, which women are most at risk of developing the postpartum hemorrhage?
All right. There are a lot of people that are at risk of developing postpartum hemorrhage, especially women that has prolonged or obstructed labor. When a labor is prolonged or obstructed, it can cause postpartum hemorrhage. Also, women that has multiple pregnancy, women that has twins and triplets, they are at risk of having postpartum hemorrhage. Then women that had big babies, after delivery of a big baby, can cause postpartum hemorrhage. Then women that already had postpartum hemorrhage before, during their previous pregnancy, they are at risk of developing it again after another pregnancy. Then any woman that is anemic also can come down with postpartum hemorrhage. Then those are also that prefer to deliver at home without any assistance or a skilled assistance. They are also at risk of developing postpartum hemorrhage. You know why I talk about the people that are anemic? Because I told you in the definition that it's not only losing 500 mils, above 500 mils or equal to 500 mils in vaginal delivery, 1000 mils or above 1000 mils in cesarean section. We talk about any amount that can make a woman to be unstable, have a hemodynamic instability. So in anemia, because there will be a blood loss, normally there will be blood loss during delivery. But because this woman is anemic already, any small blood loss will affect her. So for such a woman, is a risk factor to have postpartum hemorrhage. So that is why I included anemia as part of anemic women as part of people at risk of developing postpartum hemorrhage. Thank you.
Okay, thank you, ma. Let's look at the very big babies that you mentioned. That when the size of the baby is more than the normal size. Now,
Mm.
is there a way of uh, reducing the weight of the baby or the size of the baby even before the birth, while the baby is still in the womb? Is there a way of reducing the size?
Well, it all starts with a good antenatal. Right from the day one, when you come for the register for antenatal, there are lectures on how to diet. The only way you can do that is through diet. You'll be taught to eat moderate carbohydrates, more protein, less fat, a lot of water, more vegetables. You'll be taught on what to be eating. and you will know the things that make the baby to be big. And if you are a diabetic woman, you will manage very well so that you don't have a very big baby. So all those things, all those little things they teach you is what aggravates to making sure that you don't have a very too big baby. Because when you have a very big baby, is a predisposing factor to postpartum hemorrhage. So that is why it is good. The only way you can reduce it is coming for antenatal and listening to lectures on how to curtail what you are eating. So because it's what you eat that will actually affect the baby's size at the end of the day. So it all boils down to antenatal. If you have a good antenatal, you'll be taught on what and what not to eat so that you have a normal baby. Thank you.
Okay, thank you. Part of your point, the part of the point you made is you said women delivering at home without skill assistance. Now, are you condemning the process or the way at which our parents do make their delivery before the advent of the scientific method?
100%. Because we are no longer in the dark era. You remember those days? They will tell you a woman had 14 children. They all died. This, that, this, that, death, this, that. They don't know what they are doing. They are just doing trial and error. But these days, anything you are doing in medicine has a scientific backup. You have a scientific rationale for doing anything you are doing. So there shouldn't be any reason to record death if you have no matter how critical the condition is, even if it's diabetic in pregnancy, malaria in pregnancy, hypertension in pregnancy, they all have their own treatment and management, and they all still come out with good results. Even if it's a precious baby, we can end up doing cesarean section because why? We all know that instead of losing a baby or a mother, we better do a cesarean section and save both mother and baby. So those days they were doing trial and error, but this day time around science have opened our eyes. We know what is we can differentiate our left from our right. So why would we want to go back to the era that have passed away when you are in a new era where you can have access to good and quality health care that can sustain your life and the life of your baby? So I'm condemning it totally. There is no point going to patronize better attendants, traditional better attendant. I continue to say it every day. If you are doing that, you are endangering your life because they use you for trial and error. They don't have the scientific backup for whatever they are doing. They can infect you with sepsis, they can destroy your womb, they can lacerate your womb, they can give your baby Ehlers palsy, they can do a lot of harm than good. Except if you are lucky, you deliver naturally on your own. And all they do is just to cut the cord and all that. But then, if you have any complication, they will not be able to manage it. And worst of all, if you have postpartum hemorrhage, I heard that some of them will just mix blood and water and give you. That is a remedy. If you have such a case with them, sorry is a person's name, because before you get to the hospital, you'll be a dead person. Because this postpartum hemorrhage can kill in minutes if nothing is being done. So I am condemning the traditional birth attendant. I'm condemning the olden ways of delivering women because they are not well trained. They don't go to the four walls of the midwifery school or medical school, so they don't know what they are doing. Thank you.
All right. Jokingly, let me quickly ask you this question: are you saying all this because you are a nurse, or maybe you just say it as the way it should be?
Not because I'm a nurse. I'm a nurse. I'm a midwife. I know what I'm saying. I went through the four walls of the university and studied midwifery. I know we are taught anatomy of the pelvis. You know all these things, but they don't know have any knowledge about all these things. They don't even know when to give a cut. One of my experience when I was doing my midwifery program, there's a traditional birth attendant. There's what we call episiotomy. There's a way of giving it, but do you know this woman, when she wanted to give that cut, she just cut the woman's vagina just at the labia. There's what we call the labia. She just cut it there. And there's what we call the Bartholin glands. She could cut through that place. She could cause a lot of damage. They are doing a lot of things that is so annoying, and nobody, because there's no more legal litigations around here. But I thank God for some people are being wise these days. You can't just deliver a woman and the baby comes down with Ehlers palsy and go scot-free. is an ignorant mother that will allow you to go scot-free because you don't know what you're doing. You're not supposed to give the baby else palsy. So this people, why I'm saying it is not because I'm a nurse, it's not because I'm a midwife. It's because I know they don't know what we know. They don't know how to manage emergencies. They don't know how to deliver women. Except for, I know majority of the births are normal, especially for women that have what we call the gynecol pelvis. Any woman that has a gynecol pelvis can even deliver herself and cut the baby's cord and everything will work out fine. Yes, but it's not so for everybody. That is why you find out that some people, they go to birth attendant and they will die, either from bleeding or the baby die or anything will happen. But if you come to a hospital, all those things will be taken good care of because you are in the hands of a specialist who went through the school and know how your body system is. We know the anatomy of the body, we know the physiology of the body, we know everything to do at every point in time. That is why I'm saying and condemning it, not because I want to condemn it. I'm condemning it because for the safety of pregnant mothers and this and for good reports because it's not good that we are having Nigeria and Africa always at the end as the people that are always having everything at higher rates, everything at a higher rate, mortality rate high, morbidity rate high, when we have health facilities that we can manage. At least I know every local government has a health center and they
Okay,
are being manned by midwives and nurses.
okay,
So
let
why can't
us
they patronize them?
okay, let us consider the financial implication of this now. You know, let's compare the amount of money that they pay at the traditional attendants and the amount of money paid at the medical hospital. don't don't you think that maybe because of the financial implication, that is why most people like to patronize the traditional attendants?
Yes, I know it's because of lack of money, but if you are wise, they say penny wise, pound foolish. If you are wise, you know that there's no amount of money that is greater than your life. Even if it is higher at the hospital, you are going to get there's no, they say in my language, they say, or there's a, let me say it in Igbo language, they say, "Onye ji ego anaghị eri ofe Owerri." If you don't have money, you won't eat Owerri soup. So you have to have the money. You have to provide. These days there are what we call health insurances. You can register for health insurance so that it can cover you, so you can deliver anywhere that is a good health facility. So because if you die, that money will come out. That money that you are saving for your husband will come out, and he will still go and marry another wife without even before 1 year. So there's no amount of money that will be charged in the hospital that is commensurate with the life, a precious life of a pregnant woman.
Okay.
So that should not be even it should not even be a reason at all. It shouldn't be a reason.
All right. Let's look at the management aspect of this postpartum hemorrhage that we are talking about now. What should be the first action when a woman begins to bleed excessively? What should be the first action?
All right. If the woman is at home, the first action is to call for help immediately and ensure she gets to a health center where she can be taken good care of. Then apply a firm uterine massage. After a woman delivers a baby, the uterus is supposed to be strong like a cricket ball. If it's not that firm, you massage it. You massage it very well so that it will become firm. It will contract and become firm. Then you keep her warm. Do not delay any of these things. Those are the basic first thing you do. Okay. So there is no point going to use traditional method to take care of this woman. Like I hear that some people used to mix blood and water to give them and ask them to drink. It is unsafe. It doesn't help the management of postpartum hemorrhage. So please, let's take the woman to the hospital. When you get to the hospital, the health practitioners will know what to do. They will give you infusions, oxytocin infusion, or tranexamic acid, or if it's the retained placenta that is the problem, they will remove the retained placenta. So the most important thing is to seek for medical help quickly, and you're on the way saving a woman's life. The most important thing is if you can rub up contraction on your way taking the woman to the hospital, you can do that. I know everybody can do that. You can just massage the uterus, the top of the abdomen. You can, if you touch the woman's abdomen, you will feel the uterus. Then you rub it up, massage it to become strong. Then you rush the woman to a hospital. There they will know what to do. Like I said before, you can be given oxytocin, you can be given tranexamic acid. If it is retained placenta, it will be removed. Whatever it is, it will be taken care of because you're in the hands of a professionals. Thank you.
Okay. Thank you for that. With this, still on the management matter now, how to manage postpartum hemorrhage. Now, you know, in some community, some people try to manage postpartum hemorrhage using traditional method, such as mixing the woman's blood with water in a spoon, and they will ask the woman to take the water. And with this, is this practice safe?
It is very, very unsafe. Very, very unsafe. It is not medically recommended.
but
Please,
but
let's
sometimes,
stop.
but you said it is not medically recommended, but sometimes it works. Is it safe?
It, it is not. It does not work anything. It has no scientific rationale behind it. It is not safe, except if it is a normal vaginal bleeding that just stop on its own. A normal local, that's what we call lochia. The normal bleeding that comes after delivery. Do you understand? We call it lochia, except if it is that normal delivery, the normal bleeding. After a day, it becomes after 3 to 5 days, it becomes a little bit yellowish. So, except if it is that lochia that they are calling postpartum hemorrhage. If it is really postpartum hemorrhage, if you give the woman blood and water to drink, it will not do anything. There is no science. There is no science behind that. What they are saying, it is all fallacy. It is a misconception. It is not a good practice. It does not work. It is not medically recommended. You cannot drink your blood and expect your blood to stop bleeding. No, it's not possible.
Hmm. Okay. All right. Now, how do healthcare provide diagnosis for postpartum hemorrhage quickly?
Well, the first thing is to check the amount of blood that the woman has lost by checking the pad, how heavy it is, and all that. Then another thing is to check the pulse and blood pressure and pulse. That's the vital signs and respiration. Then if you check if the uterus is soft, that is uterine atony, or if it is ruptured. Then you check the birth canal if there is a tear or not. So within minutes, all these things that must have been done and the woman's life can be saved. So that is how to diagnose it. Can diagnose it through the blood loss, can diagnose it through the vital signs when the pulse rate might be steady and the blood pressure could be low. You can indicate that the woman is having postpartum hemorrhage. If the uterus is soft, can indicate postpartum hemorrhage. If it has ruptured, there's no point telling you that the woman is having postpartum hemorrhage. It is a definite diagnosis. If there are tears in the birth canal, is also an indication that the woman is having postpartum hemorrhage. Thank you.
Okay. Quickly, what emergency treatment are used to stop bleeding? It should, in case someone have an emergency, what emergency treatment are used to stop bleeding?
Well, like I said before, immediately you start uterine massage. You massage the uterus so that it will contract and stop bleeding. Then in the hospital, they can give uterotonics, drinks like oxytocin, triazolamic acid, and agometrine. All those ones, the health practitioner knows how and the quantity to give. Then the next thing is to remove retained placenta if it is the cause of the bleeding. Then another thing is to repair the tears. If it is a bleeding cervix, they will suture it back. If it is the vaginal wall, they will suture it back. Then the next thing is to give fluids and blood transfusion. Another thing is also to give tranexamic acid. It reduces blood bleeding. So those are the things you do. So for my listeners at home, you can just do uterine massage while you are taking the woman to the hospital. It is in the hospital that they can do other ones I just mentioned. So, but as a lay person, you can massage the uterus so that it will become strong enough to contract and stop the bleeding. Thank you.
Okay. All right. When does postpartum hemorrhage require surgery?
Well, surgery is indicated when after all the medication that must have been given refuse to,
Work.
kind of work. Yes, there are things you can do. We call it uterine artery ligation. You have to kind of surgically kind of suture the uterine arteries. or there's what we call the uterine balloon tamponade. In this uterine balloon tamponade, you insert something like a sterile balloon inside the uterus and then inflate it with a sterile water or normal saline. So the pressure from those water now block those blood vessels and it will now stop the bleeding. Then the last resort in severe cases where all these things fail is to remove the uterus completely. We call it hysterectomy. So you remove the uterus completely. It is done by a surgeon. He will remove the uterus completely and the bleeding will stop.
Okay, the removal of uterus you talked about, won't that affect the reproduction of the woman again?
It will, but it is being done when everything must have failed, especially when they consider the fact that the woman has not completed her family cycle or is still giving birth. It can be salvaged. They can do uterine ligation, uterine balloon, uterine balloon tamponade. When every other option fail and the woman has completed her family size, they can encourage the woman to do what? To remove the uterus if she's not going to have babies again. But if she's going to have babies again, they can try to suture everything so that so that they can leave the uterus for them. Like I said, it's in severe and as a last resort. That is when they do hysterectomy. Thank you.
All right. Okay. How can it be prevented during delivery?
How can postpartum hemorrhage?
Yes. How can it be prevented during delivery?
Well, the first thing is to be in the hands of a skilled medical practitioner, skilled midwife, skilled gynecologist. That is your first stage. The first stage starts from the antenatal. Let me start from the beginning. It has to start from the antenatal before even the labor starts. When you be taught everything to do, when you be taught how to give a good report of when your labor started, so that when they are using the pathograph, they will know. Because I said earlier, prolonged labor and obstructed labor can cause postpartum hemorrhage. So you can prevent it by having a good antenatal class, from a good antenatal class to going to a good hospital, to being in the hands of a safe midwife. Then things you can do management of the test stage. When you are managing the test stage of labor, you make sure you give oxytocin immediately after the baby is born. Then you deliver the placenta through controlled contraction. Then you massage the placenta after the delivery. You massage the uterus after the delivery of the placenta. By so doing, after doing all these things, you are helping to you are trying to manage and prevent postpartum hemorrhage.
Okay. How can health system reduce maternal death from postpartum hemorrhage?
Well, it can be prevented by employing skilled health professionals.
Not quack.
Skilled health, sorry? Not quacks, yes, not quacks. And for the people that we are talking to listen to us and stop patronizing quacks, because it is one thing for the government to provide a good hospital for you. It is another thing for you to go there and obtain what is being obtainable there. You can force a horse to the stream, but you cannot force a horse to drink from it. You can provide a hospital for the community, but you cannot force them to patronize the community. So we are educating everybody to make sure they attend a good healthcare center. That's how to prevent postpartum hemorrhage. Then another thing is for the facility to make sure they use oxytocin after birth. Then another thing is for those health practitioners to detect those that are at risk of postpartum hemorrhage from pregnancy. Early detection, you detect them so that whenever they are coming for labor, you'll be able to manage them very well. You'll be able to keep an eye on them. You'll be able to make sure you take good care of them so that they don't have postpartum hemorrhage. Then you manage the labor. When you manage labor very well, there's no way you can have postpartum hemorrhage. Thank you.
Okay. All right. Thank you for that beautiful response. What advice do you have for pregnant women to reduce their risk? I mean, the pregnant women to reduce their risk.
Well, my advice to the pregnant women is this: please, please, and please, start immediately you're pregnant. Go and register. Do your booking. Go and register for antenatal. After registering for antenatal, make sure you do attend your classes every day in the week that they teach. Every week or every day, any day in the week that they are doing the antenatal class. Even if you're a working class lady, make sure you take permission to go and listen to what that midwife has to say. Don't just go and collect your medication and rush back and say you have something doing. You can always take a excuse from your hospital, from your working place, that you are attending antenatal class. You will be granted, because it's important you know what to do. How you might even, there's a way you can even help the healthcare practitioner dictate when you're having postpartum hemorrhage, because you might be delivered and you have your sound baby and you are okay, and they transfer you to the ward just for you to notice that you are bleeding very so heavy, because the midwife might have other things she's doing, and maybe she forgot, or she did not come, she's timing you to come and check you at a particular time, but you started early to bleed. But because you were in antenatal, you know what postpartum hemorrhage is. You can notice the oozing of blood, the torrential bleeding in your private part. You can call her attention. But if you did not attend antenatal class, you might think it's normal. You won't know what is normal from abnormal. But if you attended antenatal class, you'll be able to detect postpartum hemorrhage and alert your healthcare practitioner, and she will intervene very speedily. Because like I said before, this postpartum hemorrhage takes just minutes. It can kill in minutes. So that every minute counts for it to be salvaged. So good antenatal care. Then when you're in labor, cooperate. When they tell you don't push, you make sure you don't push. Why they are telling you not to push is because of your service. Because they have to check your cervical dilatation. If it's not up to 10 cm, well, it face, they can't ask you to push. You find some women, they will tell you, I'm feeling like pushing, I'm feeling like pushing, and the women will be shouting, don't push, don't push. I learned sometimes some people, some midwife or some impatient midwife will slap the woman. Why are they slapping you? They're not slapping you because they want to slap you. They're slapping you because if you see the danger you are trying to put yourself in, you know that the slap is well deserved. So you don't push when you're not supposed to push.
Okay, all right.
Excuse me, I'm still talking. So you're not supposed to push when we are not supposed to push when we are told not to push, because if you push, you tear your cervix, and if you tear your cervix, you can bleed to death. So like I said, both during labor, during antenatal, during labor, and after delivery, these are you have a part to play to make sure you prevent postpartum hemorrhage. You and your birth attendant, your midwife, your gynecologist has a part to play to make sure you prevent postpartum hemorrhage. And if you are not educated well by going for antenatal, you will know when to alert them, and they will not come to your aid on time. Thank you.
All right. Thank you, Nurse Nwoko, Ezinne, Mary Constant. Just before we go on the program today, I want you to advise your colleagues, especially when they have cases like postpartum hemorrhage.
My advice to my colleagues is this: please and please, don't just deliver a woman and leave her without going to check on her, because some of them might also, they are all humans, as we're all humans anyway. They may forget what they were taught during antenatal, and they will start bleeding after delivering a woman. It is your duty to, from time to time, check the vital signs, check the pad to know the quantity of blood that is coming out. And as much as possible, create awareness. Try to make lectures like this, make your antenatal lectures rich, so that they will benefit, so that any of them that is taking excuse from their hospitals, from their places of work to come and attend to antenatal class, they will go home with something tangible. Don't just go there and collect money for medications and tell them to go, or just be teaching one topic every week. No, teach them everything, especially the most important ones. Then make sure that those ones that are at high risk, tell them, explain to them very well what postpartum hemorrhage is, what it looks like, what it feels, how to know that your bleeding is much, so that they can alert. Tell them to alert you on time. I know that we are all humans, and our workload might be too much, that we may not be able to reach all women. But at least when you cooperate with your women, your pregnant mothers, they cooperate with you. Come at their level. The ones that are not well educated, come to their level, so that they can assess you and not be afraid to talk to you. This is my little advice to my colleagues. So please, I know we are all doing much. We are nurses, we are midwives, we are doing very well, but we can do better. We can help our society to be a better place. We can help our mothers, those that are afraid of talking to us, to be at the same pace with us, so that they can relate very well with us, and be able to cooperate, so that anything you tell them to do, they can cooperate and do it. And those of you that are fond of slapping them when they are in labor, you don't do that, because it's not necessary. Just comfort, firmly assure them that they are not supposed to push when they are supposed not to push. And I believe that if you do your work during antenatal by teaching them very well, telling them the implication, not telling them when you are told not to push, don't push. Tell the woman the implication of pushing when she's told not to push, and you find out that the fear alone will make her to know that she will not push. She will even tell herself, I will not push. Even when I'm told to push, I will make sure I hear it a second time before I push. Thank you. That's my little advice to my colleagues. Thank you.
All right. Thank you for joining us on Earth Corner today, Nurse Nwoko, Ezinne, Mary Constant. Till Monday that we will meet on the program Earth Corner. From my own hand here, I'm saying bye for now, and thank you for joining us.
Thank you. Thank you, Mr. Afolabi. It's my pleasure.
All right. See you on Monday.
All right. See you too.
All right, all right. And to all our esteemed viewers, we want to say thank you for staying to the end of the program. We really appreciate you. And we did not take you for granted, because if you are not there, our purpose of being here will just be dashed out. But because you are there, that is why we are able to do more. And peradventure, you have one further question to ask our nurse, Nwoko Ezinne. Just type it at the comments, in the comment section. Put it there so that she will attend to your question the way you want her to answer your question. And on this note, I'm saying to you that thank you once again, and on behalf of the Chief Executive Officer in person of Deacon Michael Adeboye Ashaolu, who is also the founder of Eni Akwele Foundation, who sponsor this program, Earth Corner on Esteem Radio Vision, I'm saying to you, let me quickly appreciate, my man, I won't go without appreciating him for his time. That is Balogun Abisama. Thank you for your time. And on this note, from me, Adenipekun Afolabi, your prince on the show, I'm saying to you, let us remember that no woman should die while giving life. Let us work together to prevent postpartum hemorrhage. Till Monday, I'm saying stay healthy. Bye for now.
From the meals that you choose to the sleep you defend, from the peace that you chase to the strength you extend.